Hi everybody, Dr. Daniel, and today I'm talking about what should you track in a migraine diary. Migraines can come on suddenly, often without warning, and can even slip up on you while you're sleeping. Migraine is a very disabling neurologic condition. Keeping a migraine diary can be helpful for personal revelation and observance of migraine patterns. The diary will also be helpful for your doctor to study when you go in for a visit. So, what should you track in a migraine diary? In your diary, track, and I'm going to give you a list: the onset of your migraines, duration of migraines, pain intensity on a 1 to 10 scale, migraine relationship with menstrual cycle, sleeping pattern and nighttime occurrence or wake-up headaches, stress pattern, dietary foods, medications used for treatment, weather change, missed meals, the side of the head involved with your migraines, the time medication was given, medication retreatment, migraine duration, side of head involved, any accompanying symptoms, nausea, vomiting, light sensitivity, sound sensitivity, olfactory sensitivity, need to be written down, whether there's been work or missed school, and migraine triggers, and then days migraine-free. Well, how come migraine involves so many features of a normal life? Persons with migraine have inherited a special brain that's more sensitive to light, sound, eating, sleep, stress, and estrogen than the normal brain. Migraine cuts into the nitty-gritty of everything you do. Migraine inflames the sensory nerves in the brain to cause symptoms. The first cranial nerve for olfaction, which makes the person sensitive to certain odors, and it inflames the third cranial nerves, the ophthalmic nerve, which makes the person sensitive to light, and the eighth cranial nerve, the auditory nerve, which makes a person sensitive to sound. Migraine can also turn on your vomit center in the brainstem, making the person nauseated and vomit. Migraine with our patients can have visual spots or holes, numb fingers, arms, or face, or trouble talking, thought to be related to a cortical spreading wave of depression, which sweeps across the occipital lobe of the brain and forward to the parietal lobe, effectively turning off brain activity in these sensory areas. The brain then resets in a few minutes. Migraine makes a person need to lie down, like in bed or a couch, and feel so sleepy and tired and sick that they cannot get up or do almost anything. They're disabled. They miss work, school, or their children's soccer games, or many other important parts of their lives. Now, a migraine diary could be kept in a simple notebook that you get at the store, or you can get a migraine cell phone app. And I have an article on this on my webpage at drmigraine.com. What is the duration of a migraine? Who says it's a duration of 4 to 72 hours? Well, this time period is defined by the workings of the human body, not by some committee, but the International Classification of Headache Disorders, version 3, relates to the fact that during a migraine, inflammatory chemicals, which are neurokinin A, substance P, and CGRP, are released. These chemicals inflame the trigeminal pain nerve, the cerebral arteries, and the thalamus, which is called the pain center of the brain. When these chemicals come out, it takes 72 hours to get from the brain to the liver, then out of the toilet. And that's why they say a headache can last that long. This fact is known by measuring the chemicals as they pass through the human body. People will say something like, I had a migraine that lasted a week or a month or 6 months, but they're not really describing a single episode of migraine, which can only last 4 to 72 hours, but rather a condition called chronic migraine, which usually relates to medication overuse, and which gives continuous or near continuous headache. Medication overtreatment causes frequent or continuous migraine headaches. What's the pain intensity of a migraine? Well, the pain intensity of migraine is usually from 7 to 10 on a pain scale relating headache from 1 to 10. Migraine and tension-type headache are 99% of headache. Tension-type headache, by definition from the International Classification of Headache Disorder, causes only moderate headache pain. It doesn't go over level 5 or so. While my migraine patients tell me theirs go to 20, and that's a joke, but we're going to 1 to 10. So 7, 8, 9, 10 is migraine. Thinking this way, any severe headache is usually a migraine. What's the relationship of migraine with a woman's estrogen level? During a woman's normal menstrual cycle, the brain gives a signal to the ovaries to produce estrogen for the first 3 weeks of her cycle. Then the signal is turned off, the woman bleeds, and the ovaries produce progesterone for another week. Then the cycle repeats. The fall of estrogen after the 3rd week of the menstrual cycle is strongly related to migraine headache occurrence. Migraine patients with migraine without aura will usually have a migraine during their cycle and at other times during the month. But migraine patients with what is called pure menstrual migraine only have migraines during their cycle. And for most women, their menstrual migraines are their longest, the most severe, and the hardest migraine to treat. Does migraine relate to sleep? Migraine is comorbid with depression, 50%, and with generalized anxiety disorder, 40%. Both of these psychiatric conditions have trouble sleeping as cardinal symptoms. In general, even without a psychiatric condition, migraine patients do not sleep well. If you study them, they only get into light sleep, but usually not into deep sleep. For these reasons, migraine is directly related to a person's sleep cycle. Many migraineurs have attacks in the middle of the night or several hours before awakening, which is called a wake-up headache. Good sleep hygiene is an important part of treating migraine. Does migraine relate to stress? Well, stress is the number one issue that sets off a migraine. The headache may come at the time of stress or freedom from stress. It is the letdown headache, also called then. A typical story would be the busy mother who finishes all she has to do for the Christmas holidays and then has a bad migraine on Christmas Eve, Christmas Day. That's a letdown headache. An example of stress regarding migraine would be something like starting a new job or preparing for finals in college. Does migraine relate to weather change? A fall of barometric pressure is a common instigator for the start of a migraine headache. I hear that all the time in my headache practice. There are published neurologic studies that report this also. It's all over the headache literature. I always ask patients who report barometric pressure change headaches to track barometric pressure on their cell phone or their barometric pressure scale at home, then early treatment before the migraine starts. Does missing a meal bring on a migraine headache? Migraine headaches that come following eating a meal or missing eating on time are called hungry headaches. So you treat that by feeding them. That's a joke. This is a common pattern for migraine patients who many times do not take care of themselves and eat right. Oftentimes, young women will not eat breakfast. I've heard that over and again in my practice, talking usually young women, late teens, 20s, 30s, in through there. I point out that breakfast means breaking the fasting of sleep. And part of migraine lifestyle is eating 3 meals a day. Why does migraine occur just to one side of the head? Well, the answer to that is that's just the way migraine is. No one understands that migraine feature, but it is the most common symptom of migraine, which is a one-sided headache. Galen, a Roman physician living in 131 to 2001 AD, describes hemicrania, a term which means half of head. With time and different translations, it became micrania in France, and in the 18th century, and in megrim in England by the 19th century, and then finally our current word, migraine. One-sided headache occurs in about 80% of migraine patients. Also, most patients will have one predominant side where the headaches occur, such as, for instance, the right side. They'll say, 80-90% of my headaches are right-sided. Every now and then I'll have one on the left side. However, purely one-sided headaches could be, rarely, something wrong with that person's brain, such as an aneurysm or arteriovenous malformation. But if for that person a migraine occasionally occurs on the other side, that's a benign feature and just plain old migraine. I always feel better when I hear that. That's what migraine does. Occasionally it'll switch sides. Why is it important to know the time medication was given for a migraine headache? Well, this is the most important feature of migraine treatment because migraines should be treated at the onset of a headache or the aura onset with a triptan for most successful therapy. Taking a triptan at onset can give a headache-free experience, for 70 to 80% of migraine patients at 2 hours. Why is it important to look at medication retreatment? Timing of medication retreatment is important to look at possible overuse of medication or side effects of the medication. Triptans, again, the most successful acute therapy drugs, may be retreated in 2 hours, and a total dose of 2 treatment doses can be taken within 24 hours. However, I've seen patients taking triptans 3 or 4 doses every day for weeks to months, and they come in with medication-induced headache and daily headache. Or occasionally I'll see somebody, even though it says on the bottle, and I've explained it to them, they will just take 1 pill to get rid of the headache, and they'll come back and say, well, I only thought I could take 1. Well, no, you can take 2 pills, so triptans, separated by 2 hours, and you can do that 2 days a week. Some patients overusing the over-the-counter drugs like Aleve or Tylenol for migraine may take multiple doses, perhaps 4 to 6 times a day, which can quickly lead to medication-induced headache. This is an important factor for the doctor to detect and advise the patient regarding migraine treatment. What's the importance of migraine duration? As mentioned earlier, 1 single episode of migraine can last 4 to 72 hours, and hopefully the patient will be using a triptan and can get a headache-free experience within 2 hours. If effective treatment is not occurring, it's important for the doctor to note, so he may consider changing the drug, either increasing the strength or adding in another drug for acute therapy to try something else to help the patient. Why is it important to note his accompanying migraine symptoms such as nausea, light sensitivity, smell, or sound sensitivity? Dealing just with the issue of nausea, it's important for the doctor to know this. Patients tend to accuse their medication as the cause of their nausea, yet migraine is infamous for causing nausea by itself, and sometimes it's difficult to separate what is what. Was this a migraine experience, turning on your brainstem, giving you nausea, or was it a medication effect? Again, early treatment of migraine will help get rid of the nausea, and triptans are usually successful in treating nausea anyway. It's said that they treat 80% of the nausea that comes with the migraine. But late treatment may bring on nausea and longer-lasting migraines. Over-the-counter medications such as NSAIDs or Tylenol or caffeine taken too much can cause gastritis and nausea. They are also not as successful as triptans would be for acute therapy of migraine. Migraine patients during a headache like to be in a quiet, dark room. Avoiding loud noises and bright flashing lights can be helpful in avoiding setting off a migraine. Many persons with migraine are sensitive to olfactory triggers. The most common ones are women's perfumes, lotions, and cigarette smoke. Learn what your specific olfactory triggers are and avoid them if you can. Are migraine triggers important to note? Dealing with and identifying and avoiding migraine triggers is one of the most important part of treatment of migraine. It is patient's responsibility to learn this. Study my blog articles on migraine triggers at drmigraine.com. I have a whole article on that. Learn what your triggers are and avoid them. Why is it important to know the days I'm migraine-free? A headache diary that only shows 1 or 2 migraines a month for a person who previously had more is a very reassuring experience. Persons who are having frequent migraines may be on the edge of trouble. Episodic migraine is defined as 14 or less headache days a month, and chronic migraine is 15 days a month, 8 of which have migraine features. Persons with these features may be overtreating and develop medication-induced headache. Being migraine-free is a blessing and would be nice to know. So in closing, let me say, learn to use a good migraine headache diary for your own personal growth and for sharing with your doctor. Hope this talk has helped. Please click on subscribe down there, and I will see you again on another talk.